What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. That hasn't changed since last time, has it? But what has changed is the amazing human being I'm sharing with you guys today. Dr. Norma Cortez is easily one of my favorite people in the universe. I will take the liberty of saying she's a sister to me, and we connect on so many levels, including especially our love of treating patients holistically. We love to look at patients as an entire person as opposed to a tooth or even just an airway. So before I get into too much detail, welcome, Norma.
Hi, how are you? It's been a while
Oh my gosh,
since I've seen you, but it's been like
I know. I know. It's been a minute. We were talking about this earlier before we jumped on, and I think it's been like 2 years since we've met face to face. Yeah, catch up on social media, but so good, so good. So you are a general dentist, just like I am, correct?
Yes.
And you practice in Wilmington, North Carolina?
Yes, right around the coast. I love it.
Oh my gosh, I have to come visit. Why don't you tell our listeners about what is the kind of practice that you have, and I know you focus a lot on sleep as well, just like I do. So can you tell us a little bit about what it is that you focus on, and we'll kind of dive into all of that.
Okay, perfect. So I have a general practice. It's called Cape Fear Smiles. And I also have a multidisciplinary tongue-tied center called Bonded Beginning. And I treat sleep, airway, TMJ. And it all started when about 3 years ago, because Christian is going to turn 6, he started snoring in the car seat. And I just knew that's not normal. So that led me into this rabbit hole of why a child snores, what's going on, why the tongue has to do, or what it has to do with the whole shebang of airway. Then I went back to Sebastian was 1, my 1-year-old, and then remember, oh my gosh, yeah, breastfeeding was really bad with him. It was a little too late at that time to address it, but I took that to learn and empower women so they don't have to go through what I went through, if that makes sense.
Oh my gosh, that is so powerful. Because what people don't understand is, like, I was the same. I thought, I'm a doctor. I've been through school twice, right? I went to dental school twice. And of course, I know what there is to know. But even for us as doctors, and especially more so as women, we really didn't know. I wasn't able to nurse my girls too. Yeah. And nobody told me that's not normal. It's like, here's a bottle,
It's so easy. They promote the easy way out, the Band-Aid, but I think it's how this society has gone through the easy fix without addressing the root cause.
Right. And then, what our kids miss out on as well. Right now, we know not just the bonding and the benefits of breast milk, but also developmentally what they missed out on. So you want to go a little bit into that, because I know Bonded Beginnings, you address a lot of that and you talk a lot of that. So tell us about Bonded Beginnings, what you do there.
So I partner with a chiropractor, Dr. Samantha Bungie, an IBCLC, Natalie Ward, and an SLP, Brittany Kirchner, because the problems of nursing or breastfeeding is not just because of a string under the tongue. If that would be the case, oh my gosh, we will solve so many problems. But it's more complicated than that. Restrictions is not just the anatomical restrictions. It could be the cranial strains after the traumatic delivery. It could be the cells not understanding what's going on and they need to get a little bit more fit. Or it could be just the position, because you think you deliver and the baby's going to be beautifully going to your breast and it's going to nurse and it's going to be magical. And it's not. And
yes, it's not. Don't we know it?
I know. I think I'm having PTSD right now. But so yes, this journey, I approach these women and they have been my support on that. And so when we see a baby or a diet, we have to talk about the diet. It's not just one baby. You don't address the baby, or you just don't address the mom separately. It's a diet. And so you have to address them. When the diets come, we address the strains. That's where Dr. Bungie comes in, like the reflexes. We address the movement of the tongue, and then I'm the last to go and see if there is a physical restriction. My job is if there is not there after they do everything. And then we put our brains together and then we say, okay, it's appropriate to do it now, or no, the baby needs to do more chiropractic work, or a body work, which a lot of people think it's rough. It is not. It is a baby massage. Dr. Bangi is a baby whisperer. They need to do a little bit more training on that tongue before you address it, because if you address it now, which is in a surgery, and the tongue is still low tone, it's going to be like that, and it's not going to get better. So, and then we explain that to mom. At least I tell them, I'm going to empower you so you decide what's best for you and your family, and let them decide what they want to do.
Yeah, knowledge is power, of course. So I'm assuming these moms find you because they're having a hard time nursing. Is that correct?
Yes. So a lot of them find me through social media or a couple of pediatricians. Not all of them, but a couple of pediatricians are referring those moms. And I think it's because of the approach we have and the mission that we're not going to just cut, but we really are going to assess. And of course, I send them referrals or reports back to pediatricians, whether they read it or not, so they know what's going on with their patient.
Yeah. So what does that first appointment look like for the mom and the baby? Do they see all 4 of you providers, or who assesses them first and then says, okay, you need to go do this, this, or that?
So we tried it many ways. And what has worked for us in my area is that moms are so overwhelmed and tired that it's easier to come to one place as opposed to follow. So there's a little bit more of a compliance with that. So they see us. It's an hour and a half. We allocate an hour and a half, and they see us first.
All 4 of you.
The full, yes.
Perfect.
That's when we decide. If for some reason they're not breastfeeding or they're more than 1 year old, then they see me alone. And then that's when I refer if needed, because there's more compensation. The reflexes are gone by then, and there's more compensation. So most likely the surgery or release is not going to happen. So they see me first for me to refer.
Okay, perfect. For our listeners that may or may not be familiar with or are wondering, what is the big deal about breastfeeding? Why is it so important, or why are we so passionate about it? At least for those that choose to do it. Let's go into benefits and growth and development wise. Why is that tongue important? Let's dive into that.
So the tongue should live at the roof of the mouth, right? And that starts at 20 weeks in utero. The baby is learning how to suck. And before 20 weeks, the tongue is completely attached to the floor of the mouth. And then by a fancy word called apoptosis, it gets released and it goes up. And so all of that, it's the growth and development starts in utero. And the fact that the tongue goes up when the baby nurses allows for that continuation of growth. When you put a bottle or something in between, the tongue goes down. And yes, you get milk or formula or even breast milk, which is fantastic, but you don't allow for that craniofacial growth. So it's not only important for the nutritional content, the emotional bond, but craniofacial growth as well.
Correct, because the tongue is what's going to mold, and I say this in air quotes, the roof of the mouth or the palate as we have that tongue pushing against it, which is what we want, because like Dr. Cortez said, the roof of the mouth is also the floor of the nose. When we're impacting that growth, we're impacting their airway forming as well. What does addressing a tongue tie look like? You and I do it every day. So sometimes I think I tend to take things for granted because it's, you're like, oh, it's so easy or whatever. But for those that are, a lot of people are scared because they're giving us our little bitty newborns.
Yeah.
I know. It's so, I never want to give those babies back. I was like, can I snuggle them a little bit longer?
I know, I get my baby fixed every day.
Yes. So let's talk a little bit about what that release procedure, what the entire procedure looks like and not just start to finish, but appointment 1 until you're ready to release the baby.
So if a baby comes or a dyad comes and the baby is a newborn, usually we see them, we want to see them after 2 weeks, give and take. We really want to make sure that the baby has adapted a little bit. So 1 to 2 weeks, we don't do days. We assess, we diagnose, and we present the reasons why we think the surgery or frenectomy would be appropriate. I use a CO2 laser, and it takes literally 5 minutes. So we swaddle them because we have to remember babies like that pressure. They come from that pressure, from that wound. So we swaddle them to provide that comfort. And I usually tell the moms to stay in the rooms because they need to be ready. They need to be ready. And then the mom, there's a psychological connection between the release of the milk and their state of mind. So they need to be released, comforted. And so I take the baby, we do the procedure, and then I bring the baby back straight up to the boob, and it's magical. I always tell the moms, don't take for granted the fact that you are so powerful in their minds and their being. They need you, and even if it's just for you and that touch skin to skin, it's fantastic. And some of the moms feel that benefit right away.
Yeah.
Now, sometimes it's not automatically, and I always tell moms, well, think about pain tolerance in adults. Some people get a paper cut and it really hurts. Does that mean that they are over dramatic? No, they really hurt. And so they will let you know. And some people can have a bruise and don't even know that they had a bruise. Their pain tolerance is different. The same with babies. Some babies will act like nothing happened. Some babies will be really mad and they will let you know. And so there's no wrong or right answer. It's just whatever is right for you and your family and your baby. So I paint all the scenarios that can happen. And of course, if they have an issue, they'll get my cell phone so they can text me, and I have 2 post-ups within a week. I want to see how those stretches, that's another thing that we practice that day. We practice stretches because if you think about, the tongue will go down and it's a constant healing. And it takes about 3 weeks to heal completely. So we just want to make sure that there is a stretch so it continues to open or healed open, if that makes sense.
Yes.
And that is challenging. It is easier said than done. So I want the moms and hopefully the dad too within a week to make sure that the wound is healing correctly. And then depending on the situation, sometimes they already have another appointment with the chiropractor or SLP and IBCLC. They go back to their IBCLCs or chiropractors. That's another thing we respect because sometimes they send us the babies. And if for some reason they haven't, I remind them at that week that it's needed and important for them. That is if we release the baby on the first day. If we don't, we send them back for the referrals, and then we coordinate with the functional provider when the appropriate time of release based on what is needed. So if we want the SLP to be the quarterback, then that's the one who's going to say yes. And if we want the chiropractor to be the quarterback, that's the one who's going to say yes. Usually the IBCLC, it's easier because if it's a latching problem, then I don't need to do the surgery.
Correct. And I guess it depends on the age of the child. And I'm going to jump timelines just a little bit because we were talking about newborns, infants that are still nursing, and this is the age group that you release. And yes, we want the IBCLC to be the quarterback. So when it's a slightly older child, let's talk about toddlers. I'm assuming you release toddlers as well, correct?
Yeah.
Let's talk about what that looks like. How do these kids present? How do they find you other than, of course, if they're a patient in the practice, we are constantly assessing. But what are the signs and symptoms that you're looking for in that age group?
So when there are more than one, I not only assess the the tongue tie, I assess the airway as much as I can because they are weekly one. I still see them in the nursery. It's just easier. I do a knee-to-knee exam. And I take pictures because if they have teeth, you can see how those teeth are coming out. And that's going to give you signs of a good craniofacial growth or not. I address the pacifier. So I do an airway exam. And if the tongue needs to be released, it's really challenging. The ages from toddlers, like from we'll say probably 2 to 4, is really challenging to release. Not because of the release, I can make it happen because of the wound
healing. Stop. Yeah.
So I tend to do anything possible, myofunctional therapy, and then the release to maybe do it a little later, unless the SLP, once again, they're the quarterbacks, they tell me he or she cannot speak, I cannot do my work, okay. Or there is an apneic baby, and unfortunately babies or children can have sleep apnea, and if that's the case, then I can do the surgery. I don't know if you have heard about a non-ablating laser technique that they're doing. I think it's called baby lace. So I am try to see if that is going to help.
Yeah, let's talk about it. Yeah, let's talk about it for our listeners. Tell us about this. Tell us about the baby lace.
Baby lace or oral lace, it was developed by Dr. Nordstrom, and I am just learning about it. I'm not doing it, but pretty much the 1064 wavelength, it's a specific wavelength that penetrates deep and releases that hyaluronic acid from the fascia. Now, it's really important to not make the mistake of one technique cures it all, because that is what can be misleading or get us in trouble, right? So how I am seeing it is it's an adjunct to,
Yes.
like if there are cells there that are on the way, I need to move those cells away. But if there is a restriction all the way on the back, and it's one of those cases that you're like, I don't know, maybe chiro, maybe this, well, that is perfect, because that 1064 wavelength can melt that hyaluronic acid away. You can apply it to trigger points, and you can do trigger point therapy with that. So it gives a more holistic approach. But if there are cells to cut, you have to cut them later, right?
Correct. I love the fact that you said there is no one size, there's no magic wand, because which is what I always say. There's no magic cure for anything. It's usually a combination of things as to what a particular case needs, right? If I were your patient, I may need something completely different as opposed to the next person or the next person. So I love that you also have that approach. You treat adults as well. Is that correct for sleep apnea? Okay, let's get into that. What overall, yes, we all know we can treat our patients with an oral appliance. As dentists, that is a great alternative to CPAP. But what other alternative therapies are you incorporating for your adult patients as well?
So in my mind, I had to divide it with maintenance of sleep apnea and sleep disorder breathing, and trying to get the root cause under control, right? That's what I had to do in my mind. So you can maintain situations, or you can stop the patient from choking with a mandibular appliance, maybe some laser therapy as complement, or you can try to address it. And the great thing about dentists, whatever we can do with the occlusion or bite influences sleep disorder breathing, which is really important. I always tell my patients, I do not diagnose. Unfortunately, it's not my scope of practice, but I can influence. So on the trying to find the root cause, we can do functional frenuloplasty to address that tone. Now, when I treat children and adults, it is a must. They have got to be myofunctionally ready.
Yes.
So I do not cut on the fly. I send them to the speech language pathologist or hygienist. There's some of them who do myofunctional therapy. And when they are ready, I release. That's one approach. Extension of the art can happen in adults. It's challenging. And I know there might be a controversy going on right now. You have to be careful. Right.
Right, exactly. And it all depends on case selection, right? That's what we're taught as doctors when you come in. Same thing, no one size fits all. It depends on the case. We do that for dental stuff, right? I say this in air quotes, what material we're going to pick for a crown that we're making. It's not a crown is a crown is a crown. Do I need gold? Do I need zirconia? Do I need ceramics? What do I need? And that's exactly what happens with expansion in adults too. Right. We get into trouble when we decide, we're going to use this one appliance across the board. And that's when the problems happen.
Exactly. And sometimes tipping teeth will help the patient tremendously, and that will give more space to the tongue. And guess what? You can do that with Invisalign, for example, or brackets.
Yes.
So expansion doesn't have to be that fancy word. You need more expansion. You can do MSE or MARPI. Tats open. You are a holistic patient. Well, let's try the DNA appliance. Let's see how that works.
Are these all options you provide within the practice? Just for listeners who may be looking for specific providers in their neck of the woods, so like in North Carolina, do you provide some or all of these?
Some of them. I don't do DNAs or ALS. You have to learn a little bit more about those. So with a 5 and a 3-year-old, I need to.
I get it. Yes.
But
there's only so many hours in the day.
I know. But for children, sometimes a regular rapid palatal expander will do the job. And that is pretty much orthodontic. So I do have an orthodontist in my office.
Beautiful.
Who can help. I do expand children from 2+. You can do that with prefab appliance. So I'll try to do as much as I can, but no, I don't do the ALF or DNAs or homeoblog. Maybe later in the future, but not now.
Yeah. Beautiful, beautiful. So as we wrap up, how can our listeners find you? Where can they find you? How can they come get you to be their dentist? Share a little bit about your practice, where you practice, and how they can get a hold of you.
So we are in Wilmington, North Carolina. That's the code. My general practice is Cape Fear Smiles, and that houses Bonded Beginnings. You can find me on Instagram as the biological airway dentist. And I don't know.
She is also on TikTok. I follow this woman on all social media channels. So she's also on TikTok. I think your user handle is the same, correct?
Well, for the TikTok page is Cape Fear Smiles.
Cape Fear Smiles. Okay. And super active there, even on Instagram and Facebook as well, right? The biological dentist. Yeah. That's amazing. So for our listeners, I will have all of her contact information in our show notes. That way you will have instant and immediate access to it. I'll have her office information, contact information, and email if they have that. And then all of her social media handles. So you know where to find her. If you have a loved one or if you're one that is along the coast in North Carolina and needs an amazing dentist. As before I let you go, Norma, what are your top 3 tips for parents?
My top 3 tips for parents, I would say follow your mama gut. That's the first thing. So don't let people or doctors gaslight you. And don't receive a no for an answer. That will be my second. If you think something is just not right. And don't be afraid to ask and seek second opinions. I think it goes within the whole theme, but that will be my third one.
Perfect. That is beautiful. That's exactly what I would have said as well. Thank you so much for spending time with me today. I know it's always hard when our littles are at home. I know mine are in bed. We got an early phone call in. So thank you for taking time. It's always so good to see your face.
It was nice to see you. And
Absolutely.
You're welcome to come to Wilmington whenever.
Oh, watch me. I'm going to be on the next flight out that I can. For our listeners, don't forget to share this episode. Some good information about an amazing dentist and an even more amazing human being that I am thankful to have in my life. Share, leave us a review, and I will see you next time.
Thanks.